There will be no sale of the NHS, no privatisation.
Now, we all know the NHS is being severely cut and under-resourced, and this means some procedures that used to be available on the NHS are no longer available. So those services clearly cannot be accessed free at the point of use. It absolutely is being privatised. And this journey has been taking place over at least 30 years. It started with the outsourcing of ancillary services, and then in the 2000s we had the outsourcing of clinical services. Routine operations were outsourced, and we've seen recently PPE contracts were awarded to the private sector, often without any competitive tendering. And the biggest outsourcing privatisation scandal is the test and trace system, which was £37 billion squandered. When services are outsourced to private providers, their main duty is to maximise profit for shareholders. And how do they do this? They cut services to the bone, they employ the cheapest and fewest number of staff, and this clearly has a patient safety implication. If patients and public understood how important this was, they would certainly mind that their once publicly provided service, run by well-trained professionals, is now provided by less trained people, and profit is being extracted at the cost of providing care. This is again an untrue statement. There is around 120 billion a year going into the NHS, but where is that money going? We know that more than 10% of the NHS budget is eaten up by the unnecessary commercial market within the NHS. We know that private finance initiative debt is also sucking out billions out of the NHS. So it's more important to find out where the money is going and not how much is going into the NHS, because more and more of this is being siphoned away from patient care. Now, the word integration sounds very comforting, but what's going on in reality is you're having merging of budgets, and those budgets will be handed over by the new NHS bill over to the control of insurance companies from America. So this is integration of money that they're describing, not integration of care, which has been gradually fragmented over the years and has become increasingly complex. Patients have difficult time accessing services, so we've had 30 years of disintegration, and the bill will not integrate services for the benefit of the patients. Absolutely not. The intentions of the bill were laid out even before the pandemic arose. What the government is doing is using the chaos and worry around the pandemic to force through legal changes which will take the NHS more down the road to privatisation. In fact, some people consider this as a final nail in the coffin, handing control to giant US corporations like United Health, their biggest private insurer. Please help us spread the word about this problem and raise awareness about the threat to the NHS of the current health and care bill. Please go to www.yournhsneedsyou.com and follow us on social media.